We're excited to welcome Dr. Nicole Torres, who is the Assistant Professor of Clinical Pediatrics, the Division of General Pediatrics, and she received her undergraduate degree from the University of Miami. She earned her MD from the University of Illinois College of Medicine, and then she went on and completed her residency and her chief residency at Holtz Children's Hospital, Jackson Memorial Hospital. So she's a board certified doctor in general pediatrics. She practices at UHealth Pediatrics in Kendall, where she cares for children of all ages from infancy all the way to young adulthood. And in addition to clinical care, she's actively involved in the education of students at UM's Miller School of Medicine. And she served as the former Associate Program Director of the General Pediatric Residency Training Program at Holtz Children's Hospital. So Dr. Torres, welcome. We're so glad you're here tonight.
Thank you. Thank you. My pleasure to be here. Always excited.
Well, we can't wait to pick your brain about all things pediatrics. So I have 4 little people. So we spend a lot of time at the pediatrician. And sometimes I'm like, could I have solved this at home? But it's good to go to the experts. This is what I've learned, because we can't be trusting Google. We got to go to the experts. So tonight we've got you, and I'm so excited. So again, I guess who are listening, if you have a specific question, drop that in the Q&A and we will get it in front of Dr. Torres. But let's start with, my kids are all the time falling, bumping their heads on things. So at what point, let's say a kid falls off the bed, hits their head, do we take them to the ER? How do we know whether or not to take them to the Holtz Children's 24-hour ER?
Right. So that's a really good question, because it happens a lot. Toddlers are especially just, figuring things out gross motor wise, and they stumble and they fall, but they roll off of beds. And I'm guilty. I one time did not take my own advice, and my 6-month-old rolled off the bed. I will admit it. And so big things to look out for. Oftentimes they are stunned and they cry. And if they're stunned and they cry and they settle down, and they don't appear to be sleepy, they don't appear to have a loss of consciousness, that's a big one. So even if it was momentary, that's always a big concern. And if there was vomiting. So those are kind of like the 3 things that we would be worried about, but specifically vomiting. So a head injury and then vomiting, and head injury with some loss of consciousness, even if it's brief. Goose eggs are very common. So the head, the scalp is very vascular. And so you can definitely get bumps underneath the scalp, which in Spanish, I don't know in other places, but we call them chichons and goose eggs. And you can just put ice on those. And those can be very prominent and scary, but that's just kind of more like a superficial injury. The truth is that in any circumstance, if there is any concern at all and you're not sure what to do, the best thing is to always call your pediatrician. We exist for a very specific reason, and that is also to empower families to take care of their children and make good decisions. And so, quick Google searches often help, but if there's any doubt, call your doctor, because they know your child. And that's a really important piece of advice in general for all questions. But for the most part, if they are stunned, cried, and they're happy, you're probably fine.
That's good. That's good. Maybe we'll get to this later, but on that note, this kind of makes me think, what if they recover, they don't lose consciousness, but if there's they're bleeding a little bit, how do you know, oh, this might need stitches?
So that can be a little bit more difficult. If you put it together and you hold pressure for a little bit, and obviously it should stop bleeding. And if you hold pressure and it seems to want to stick together after several minutes, you might be okay. If it wants to open up, or if you see, especially on the scalp, if you see white, that means it's pretty deep, and then you should probably definitely go get evaluated.
Oh, yeah. No stitches in our house yet, but with 2 boys, I feel the day was coming.
Yeah.
So hopefully not. Okay, great. Let's talk about now, it's the season, but at what point is a cold more than just a cold, and when should we take our child to a doctor?
Yeah. So the truth is that colds, so runny nose, cough, congestion, and fever have this natural time course of about 10 to 14 days. So it seems very surprising. I think oftentimes we're very accustomed to sniffles that peak maybe after a couple of days and everyone is recovering maybe 5-7 days total. But the truth is that it can last a lot longer than that in terms of residual symptoms. So I tell parents that typically things will peak around the 4th or 5th day with kind of like this taper of symptoms for another easy week and a half sometimes. And so that's and the predominant symptoms like the congestion and the mucus and the snot and all that really hangs around for a long time. So and fever really shouldn't last more than a handful of days. If there's fever for more than 5 days, we always say come to the pediatrician. I don't think parents ever wait that long.
Usually within a long time.
Usually within a day or two, and that's fine. So there's a few things. Like for example, if your child has a fever in the middle of the night and they wake up the next morning and they look okay to you, and we have some respiratory symptoms, we started some congestion, you know that a few days back they sent a note saying that there was, you know, some sort of viral illness going around in the daycare or the school, then chances are that's what they have. And if they are perky, if they have symptoms but look to be breathing comfortably, they will nurse well, or they'll take a bottle well, or they'll drink, then for the most part you should be okay. You don't have to rush. Rushing means if they look like they're having any trouble breathing, if they're pale, lethargic, you know, for a pediatrician is a big buzzword, and that's a child who is just so out of it, they're difficult to arouse. Those are big emergencies, and you need to be, your child needs to be seen right away. But for the most part, respiratory symptoms can last for, often will peak like 4 or 5 days and then kind of taper. About 30% of kids, even 10 days, 14 days out of the start of a respiratory illness, will still have congestion and will still have cough. And then the only other thing that I would say is what I tell my parents is that if we've had respiratory symptoms and no fevers, and then we start to have fevers later on, day 4 or 5, and it didn't start with the illness, it's probably worthwhile to get checked out. And then I'll just make one more point about kids and colds. There's something called viral stacking. And I think if you have a child in daycare, this is going to make sense. They are sick. They seem to be improving. You maybe have one day where everything seems dry. There's no snot, or the cough is minimal. They're sleeping through the night without really doing anything. And then the next day, it starts all over again. There are tons of viruses out there, and they'll stack. So as soon as they're improving, they've already been exposed to something else in the daycare or the school, or you know, or wherever they are, learning co-op or whatever. And then we start with the uptick of symptoms again. So most oftentimes it's not one big long illness. It's illnesses that have kind of stacked upon each other. It's still not fun. But
yeah, you're like, why can't we get well? We've had
why can't we get well
for 4 weeks, but no, we probably have 3 colds.
Right.
3 viruses.
Exactly. Right.
Okay, now that makes sense. So on that note, let's talk about medicines. What medicines are safe to give our children?
Got it. So in general, medicines that reduce fever, so ibuprofen and Tylenol, or ibuprofen and acetaminophen, dosed according to weight, are safe, and dosed according time-wise. So Tylenol every 4 to 6 hours and ibuprofen every 6 to 8. It's good to know what your child's weight is, because it's on the box, and the boxes, you know, the labeling is set up in a way that if you have an approximate weight, you can give an appropriate dose. And as long as you follow the dosing instructions, you should be fine. Cold medicines are kind of a different story. So really there isn't any evidence that honestly cold medicines, like things for cough and things for congestion, actually improve symptoms. So, you know, oftentimes adults will take some Sudafed or some cough suppressant, and it makes us feel better, or NyQuil. But we generally recommend against those, in part because they don't work as well in kids. And secondly, they can lead to secondary side effects like issues with the heart, like increased heart rate and increased blood pressure, which if you're a healthy kid, probably isn't as big of a deal, but it certainly can happen.
Okay, that's great. Yeah, I know. My husband said before, why can't we just give them some NyQuil? I'm like, babe, we
Yeah.
can't do
We
that.
could do that. Yeah. So, I mean, and then there are other medicines out there. So oftentimes, I mean, I think it's been forever since I've heard of Tylenol with codeine, but that's an opiate that causes respiratory depression. There are other stronger medicines that, sometimes are used, but really, if you look at the FDA warnings, none of those cold cough medicines really should be used in children younger than 6.
That's right. That's right. What about, I've also heard that babies under 6 months should not use Motrin. Is that true?
Yeah.
Or
So,
Flonase?
yeah. So, the ibuprofen or Motrin, yeah, it works in a variety of ways, and there is an effect in the kidneys and the way that the kidneys work and filter. And so, I usually say wait till 1,
Mhm.
but that's because one of my really good friends from residency is a nephrologist. So,
Great. No,
but
that's
yeah,
good to
6
know.
months and up, or a year and up.
Okay, great.
Mhm.
And I will say we got a comment from the audience that said, thank you for your commentary on viral stacking in daycare. That's been her last 14 days. She said, now I felt a little less crazy. So we're so
Yeah.
glad. Thank you for helping us all feel a little less crazy, answering these questions.
Yeah.
It is so helpful. And again, if anyone has a question while you're listening, just drop that in the Q&A. We'll get it out there. Okay, what about, talking about those that get sick all the time, or maybe they're in daycare, school, all the things. Is there anything we can give our kids to help them boost their immune
Their
system,
immune
kind of
system.
be
Yeah.
defensive against this?
Yeah, I hear that a lot. And I will say this. The first thing is that when there's fever, when there's snot, when there's cough, that's actually the immune system working. That is your body saying, hey, we need an elevated temperature, and viruses and bacteria don't like elevated temperatures, and it allows the immune system to work more efficiently and work better. And so that's a natural response of the body to fight an infection. Fever is not bad. There are certain instances where fever is not good, and they're very specific, like when your baby is itty bitty and they haven't had their vaccines. And in certain instances, if a child is immunocompromised or something along those lines. But overall, in a healthy child, fever is not a bad thing. And coughs and mucus are byproducts of viral illness, but also your immune system working, white blood cells working, and all that stuff. So that's the first thing. So it's encouraging, right?
Yes,
Sort of.
it's doing its thing.
It's doing its thing. And oftentimes what we need is for them to do their thing with a lot of time and patience and love. That's how we get through these seasons. So I really don't recommend anything in particular to kind of boost the immune system, because you really only need a little bit of a lot of things, not a lot of one thing. So, big doses of vitamin C, your body only just needs the little bit to maintain health. And that's, pretty true for all sorts of nutrients. So if your child has a well-rounded diet and eats from all food groups and isn't super picky, should be fine. Now, practically speaking, there are a lot of kids who don't get as many fruits and veggies as they should. And does a vitamin kind of help there? It's better to get our food, our nutrition from food, certainly. And most kids are unlikely to be vitamin deficient, maybe vitamin D and iron if they're super picky in terms of diet.
That's so good. I thought you were going to recommend, you should take this, and this. And I'm like, I'm kind of encouraged because we all don't do another thing to remember.
Yeah.
So
and
that's good.
Yeah. And the younger kids can remember hygiene, hand washing, and honestly, like not touching their little face and putting their hands in their mouth, which is really the way that they get sick, right? We just, germs enter, the nose and mouth, and that's kind of like the hard thing. But you can train your kids not to touch their face.
Wash your hands. I'll say COVID has probably made, this generation like the best hand washers ever. So thank you for that. But germs, still travel. A couple of questions circling back to the medicine topic. One from our audience says that they've been advised to use kids Flonase for their 2-year-old. Is it something that they can administer if they're congested, or should they just kind of use it sparingly?
Got it. So there's indications for Flonase, and it's a steroid for the nose. It decreases inflammation in the nasal passages. So there's a good reason to use it. It's usually allergies. Now, sometimes we use Flonase for other reasons. And so if the pediatrician made it clear to use it, then follow your physician's instructions, but it isn't a medicine that works like ASAP. So for example, like Afrin, which is a medicine that shrinks nasal passages right away and provides relief from nasal congestion. I never, ever, ever recommend it. The rebound congestion is even worse. So never use Afrin, really.
Yeah.
But the Flonase isn't something that will help a one-time kind of situation. So circle back with your pediatrician and make sure that you know why it is that they asked you to use it. I think sometimes we might not be super clear, us as physicians, to explain why we're using certain things and the reason that we ask you to do it daily or twice daily or as needed or for an extended period of time. So if you're not sure, circle back to your doctor.
That's good. That's good advice. Okay, one more question in relation to that is, this parent says, can you clarify about the dosage to weight? She said most toddler medicine is, 2 years plus, but her daughter's 18 months and 99 percentile weight. So oftentimes the doctors have increased her dosages. She wondered, is there a way or a place to kind of calculate proper dosage and know which medicine she can take, or just always, again, check with her doctor?
Yeah. So if you're unsure, I will call the pediatrician and just have them help you get the right dose based on weight, because it depends. Dosing on weight is per kilogram, generally how we do it. So it depends on how much they weigh in kilos. And ibuprofen dosing is one way, Tylenol or acetaminophen dosing is the other. So you should always check. And the last thing you want to do is underdose too. And I find that parents sometimes get worried. They're like, we gave them a little bit of Tylenol, and a little bit of Tylenol is not going to do it. So if you're going to give them medicine, you might as well give them the appropriate dose, and weight-based is the way to go.
That's good. That's good. I love that tip too about knowing how much our kids weigh, because I think we do our well visits, but kind of in between those on any given day, I'm like, I don't know what my kids weigh.
Yeah.
So throw them on the scale.
And once they're bigger, it's once a year. So obviously it makes a difference. You can estimate, you can put them on the scale and, that kind of stuff. In the middle of the night, it's probably not the most, but for the little ones, it's probably a good idea to have on hand what the weight might be, because any pediatrician in their sleep could, give you the dose based on weight.
That's right. That's great. All right, let's talk about fevers. So what can we do if our child has a fever?
So again, remember, fever is the natural response of the body to fight an infection. It's not bad. And there are things that you can do that don't require medication. The first is nothing, which I know sounds almost sacrilegious, but you don't always have to treat a fever. I've seen kids with 103s in the office and they are bouncing off the wall. My advice is always treat your child, not the number. So some kids have fevers and they're miserable, like when you have a fever and feel miserable. But that doesn't necessarily mean that you need to treat the temperature also. So if you go by treat your child and you really think that they're really feeling crummy and it would be nice, to take the edge off the temperature and the way that they're feeling, go ahead and you can give them medicine. You can do like a cool compress or kind of like a room temperature compress. You don't want to stick them in an ice bath. That will actually make them shiver, and shivering is our body's response to generate heat. So you actually make the temperature worse. So what you want to do is try and cool them down. Behaviorally, we feel cold and we shiver. That's, the increase in body temperature that our brain is looking for. And we put on sweats and they want to get under the covers. And that's how we make a temperature. So keep them in light, in light clothes, but don't let them shiver, because that's going to make it worse. Right. If they're sleeping, honestly, leave them alone. Don't wake them up for the sake of giving them medicine. If you got them to sleep, rest is really, really important. If they wake up, if they're starting to rouse and you feel like, they'll be awake enough to take some medicine, if you feel like that's important and you need to treat the fever, go ahead and do that. But if they're sleeping, let them rest. Yeah.
I love it. That's great advice. Okay. Can fever cause brain damage? Because sometimes if it gets high, that's what can get so nervous,
Right. So that's a really good question. And the short answer is that very rarely do fevers generated by a respiratory illness or a viral illness, or even an ear infection, which can be bacterial, will cause brain damage. Fever associated with brain infections like meningitis or encephalitis are a different story. And that's rare. But kids can have fevers as high as 103 and 104 and change. And that's still not high enough to cause brain damage. And a healthy brain will turn the temperature down eventually. Or you do it with medicine. There are other entities like heat stroke and heat exhaustion, which are different, or hyperpyrexia, which is kind of like a different setting, in which case then that could be a problem.
Okay, that's great. Good advice. You're putting us at ease. Okay, so we're talking about cough. What would you help with a cough if you're like, maybe not so much the cough medicines, or maybe so? What do you say?
Yeah. So honey, if they're older than 1.
Right.
So you can thin it out with a little bit of water, or you can do like a warm apple juice or lemonade, or even water, and put some honey in there if it'll make it easier for them to drink. It's very soothing and settles a cough.
I've never thought to put it in something with them, so that's good.
I mean, my kids never really liked honey, and I was like, I swear it's good for you, but they don't always listen. You could do steam. Steam was a big thing in my house. My son was, the notorious crouper. And the moment that I just heard that little cough, any mama or daddy who knows, who's had a crouper in the house knows exactly what I'm talking about. But steam, just turning on the shower, if you have more than one bathroom in the home, the smallest bathroom that you have, turn on the shower and just fill up the bathroom with steam. We took many naps and, night shifts on the bathroom floor with towels and comforters, because the steam is very helpful. It soothes for cough. And then Vicks, it kind of can settle a cough. You don't want to use Vicks in really little ones. There's a baby kind of version. The vapors can actually make congestion worse and cause more trouble breathing when they're younger. But with the bigger kids, you can do a little bit of Vicks, honey, saline. And if you think about cough, it's always worse at night. It's generally associated with congestion or mucus. And when you lie back, you get postnasal drip. And that too will also kind of irritate and cause a cough. So if you can help with the nasal symptoms as well, and then sometimes you can help with that postnasal drip, being propped up, we just kind of sleep with our itty bitties, on our chest, or upright.
Talk to us about the saline. I know my pediatrician has told me that too. My kids get congested all the time. And I've never done it because I'm nervous of how to do it. But will you talk us through kind of like how to do that?
Sure. So you can find saline over the counter, Little Noses, Simply Saline, Arm & Hammer. There's a bunch of them. There are some that are like squeegee bottles, and then you can do drops, or you can squeeze hard and they spray. And then you have ones in canisters, which you spray and it kind of like comes as a mist. Saline does a couple of things. It moisturizes nasal passages, which is good. And then if you do nice, good shots of saline, what you're trying to do is get up in there and loosen things up so they can drain. So if they're very stuffy or they have thick mucus, you're just trying to get it out, because that's what's always going to make them feel more comfortable. If you're congested and you're breathing through your mouth, nobody likes that. And then you can also do some suction, and I advise light suction. There's a product called Nose Frida. When I found it, I bought 5 of them and had one in my house, and then a spare, and then one in my mom's house. And just a light suction is helpful. If you get a lot of boogers, great. Just a little shot of saline and then call it a day. You don't want to over suction. You don't want to get it up in there, because that can also damage the delicate tissues in the nasal passages. And if you overdo it, you can actually make congestion worse, because now the tissues are unhappy and they get puffy again.
Yeah. Okay, great. So you're saying saline, suck, saline.
Yeah. And gentle.
Okay. You're giving me confidence, because I'm like, I got these runny nose kids, and I'm like, you ought to do the saline, but I'm just scared about it. Just
do it. They're not fans, but it's helpful.
Let's do it. That's great. Okay. Talking about, saline and Tylenol, Motrin, ibuprofen. What are some things, if we are going to go on vacation, are there things that we should kind of keep with us as like, in case somebody gets sick?
Yep. So I always travel with either Tylenol or ibuprofen. Just, make sure that if we have a fever, if someone has a headache or anything along those lines, I have that readily accessible. I often travel with an antihistamine that's safe for kids. So something like cetirizine or Zyrtec or Claritin. I always travel with, since my kids are kind of sensitive and allergic, and so am I. And so I always have that there. Go to a hotel room and you find that it's a little dustier. Travel with that. Travel with saline, especially when they were younger, not so much now. And then, maybe like an antibiotic ointment, just in case we get a scrape and we want to put it over, Band-Aids and things like that. Just kind of a simple toolkit.
Speaking of scrapes, talk to us about what's the best way to like treat those, and how do we know, get lots of boo-boos when they're itty bitty. What's the best way to treat them?
Yeah, great question. So you wanna clean it off. So if it's, a scrape on the road or the asphalt and it's dirty and there's dirt, you can just honestly use a very mild soap and warm water and just kind of gently rub and rinse and rub and rinse. Sometimes just, rinsing. If you want to get fancy, I don't even know if they have it over the counter, but if there's like saline for wounds, you can kind of like squirt that. But really what you're trying to do is just flush and clean it up, dry it up, and then you kind of see what you got. Most times you can leave it uncovered, as long as you know that they're not going to bump or scrape themselves again or get dirty, in which case then you do want to use a Band-Aid or a gauze or something along those lines just to protect. But skin likes wounds like to have some air, and so that will help to eventually dry things out and then slowly but surely heal.
That's great. A couple questions from our audience on topics we've already covered, so let's circle back a little bit. But if someone's asking, is there a certain temperature that you're like, "Ooh, take them straight to the ER"? Is there a number, or like you said, with the child again?
Yeah, so I still go for treat your child, not the number. Now, if we hit a 104, go. Especially if there isn't anything else. So that's why sometimes it's like, you're like, well, if we have a 104, but we know that they have flu, okay.
Flu.
Or maybe we're suspicious of flu because they also have like this hacking cough and it all started all of a sudden and they have body aches, because influenza does give high grade fevers. So, I'm always about treat your child, look at your child, because a low grade temperature in a child that doesn't look right is still of great concern, regardless of what the number says.
That's good. Yeah. And I'll plug that Jackson has 5 urgent care locations. So if you can't get in with your pediatrician, swing by urgent care. Okay, back to the coughing. Someone asked, are humidifiers helpful? And what about essential oils? Do you recommend?
So as far as humidifiers go, I always get this question. And to be honest with you, I'm like, I don't know. Is it cold or warm? The only thing that I think about humidifiers is that it really needs to be close to where they are to get the benefit of the humidification. So if you have it in the corner and the baby's in the crib, it's probably not going to do you all that good. And as far as essential oils, it kind of goes along the same lines of, Vicks and menthol and things like that. So you don't want anything that's going to be super strong that can irritate nasal passages and airways. My son, the Cooper, one of his teachers recommended thieves oil, and I was like, I will try anything. And I tried it. I don't know. And we tried it over several, episodes. It was a time that he was sick often. He was little. I don't know if it ever really helped. It helped me kind of think, well, I've tried all of the things that I think I could have tried that wouldn't cause any harm, and it smelled nice in his room. I don't know if it really helped.
Yeah. Hey, if you like the smell, maybe it's
it's lovely
self-care for mamas who are surviving with sick kids. I don't know.
That's the hardest. That's the hardest thing, is to spend, up all night with your baby or with your big kid, and then just, kind of get maybe very little sleep, wake up to start your day and kind of go about as if, nothing ever happened overnight. It's the hardest thing, and oh my gosh, if there was something that I could give that would make everyone better faster, I would do it, because we don't want to see kids suffer. For everyone. We don't want kids to feel miserable, but it's tough.
Yeah, that's so good. Thanks for sharing that. All right, let's talk about diarrhea. Is medicine? Is there, I mean, what do you do?
Yeah. So for the most part, no medicine. It's kind of like, it's definitely not fun.
Yeah.
But the intestines are unhappy and they start moving fast and everything's going to go. So you actually don't want to slow things down. It can make things worse. Most diarrheal illnesses are viral in nature and they will run its course. Again, course means not better within a day or two, but several days.
Yeah.
Concerns would be if you see blood in the stool. That's always doesn't necessarily mean a red flag, but you should probably bring it up to your pediatrician. And mucus. So that just kind of tells you that some sort of inflammatory process is going on and you should probably get checked out. But you don't want to really stop it. You just want to hydrate your baby or your child. So offer fluids, Pedialyte, water, quite a nurse formula, anything really that they'll take now is what the focus is on, is keeping them hydrated.
That's good. I've heard people say, my mom always said, this is like, I don't know, from the 80s, maybe, that she's like all about, but she always says the brat diet, when there's like a tummy, something like bananas, yeah. Is it bananas, rice, apples
and toast?
Okay. Yeah. This is mother's advice.
Yeah. So for the longest time, it was brat. When I started practicing, my little after visit summary said brat diet. And then it seems now that it doesn't make a bit of difference.
Yeah.
Interestingly enough. And so the big thing is making sure that kids are nourished during an illness. And obviously they're not going to eat as well as they did before. When you are not feeling well, your appetite is not the same. And that's a natural, kind of part of an illness, but you certainly want to make sure that they're nourished. And so if they are willing to eat whatever, now some things are better than others. I wouldn't suggest, something heavy, greasy, or fried, if the tummy is really upset, or spicy or anything like that. But you don't necessarily have to stick to a brat necessarily.
Hydration is so important.
Yeah, it might be helpful to switch from like a lactose-free milk or formula in the short term, but even that, the evidence, long term is still kind of like, probably is not that big of a difference. They're transient lactose intolerant, and so if that milk sugar is hanging in the gut, it can kind of cause more diarrhea or worsen things or prolong things.
Okay. Makes sense.
But if that's all they will have, then that's important for them to be nourished
and hydrated. That's good. Okay. Rashes. I know all sorts of rashes with kids. So how do you know when one is worth going somewhere or putting something on it or not?
Yeah. So that's a tough one because rashes can be all sorts of different things from all sorts of different sources and reasons for rash. I will say that viral illnesses and rash, they're besties. And oftentimes viral illnesses will present with rashes or viral exanthem, as we call them. And it's very broad. Certain viruses cause certain rashes like measles and a certain look of varicella or chickenpox, for example. But most of the time, viral rashes just look like red splashes all over. So it really depends. If it's a generalized rash, so it's more than one area, or it started in one area and it's spread, it's probably a systemic reason, either an allergy, and it kind of, allergic rashes kind of have its look. They kind of look like mosquito bites and then they grow and go away and they're a little bit elevated, and they tend to be itchy. And viruses can also cause hives or urticaria. So there's that. But usually viral rashes will be red bumps, and they'll kind of be all over. One thing that if you do call your pediatrician asking about a rash, especially if your child is febrile, is they'll ask if the rash goes away when you press it, or what we call blanching. And this is kind of an important thing for the pediatrician to say, yes, go in immediately, or no, we can see you tomorrow. So a great way to know if it blanches is you just take a glass, just a cup, and you press it. And that way through the clear glass, you can see if the rash goes away, if it blanches. Or if you don't have this. Or if you press it, hold it, and then it the redness comes right back, that's a blanching rash. And it can still be a problem, but it's not as problematic as one that stays even if you press.
Wait, you're saying if the rash stays if you press, or the rash goes away?
If the rash stays when it's pressed, then that's more of a concern.
Okay, gotcha. Wow. Well, we just survived hand, foot, and mouth, which is a not fun rash.
That is a not fun.
So any tips? I mean, now that it's over,
over,
else who might get the pleasure?
Yeah. Hand, foot, mouth is terrible. I actually had as an adult, and it's such a misery. Very common in pediatric, in the pediatric population, especially the youngins, like that toddler age. And it is, just as you said, it's just ulcerations and just a miserable experience. Their throat is raw and ulcerated and super painful, and then they get them on the hands, on the palms and soles, but it can creep up even around the fingertips. It's about keeping them comfortable in the end, and so that means popsicles, ice chips, anything cold, and using pain medicine, if it helps. Sometimes it's helpful to do, like a half hour before you want to get them to eat or drink something, probably mainly drink.
That's good.
And then, in the end, it'll run its course.
Work itself out. Yeah. Yeah. Not fun.
Not fun.
We spoke a little bit about diarrhea, and we got a question kind of on the other end, in terms of constipation. Would you recommend any like periodic remedy or like a supplement for constipation for kids?
So some constipated kids make constipated adults. And so even if you change the diet and add a lot of fiber, sometimes that's not enough. Making sure that they increase water intake is really, really important, because when you increase fiber, it bulks up the stool, but the water needs to be there to soften it up and make sure that it can move along. And some people's kind of transit time is slower than others. And if it's slower, it means that it hangs there longer, water gets absorbed more, and you just kind of get backed up. My advice is always to use something dietary from the get-go, and prunes work great. And so that's usually what I'll advise. And if that's not enough, and we've tried all the things, and there are medications that we can use to kind of get them going regularly, especially so that the stools aren't painful, because you don't want children, especially if they're close to being potty trained, to have painful stools. Makes potty training that much more difficult.
Okay, good advice. Prunes it is.
Yeah, prune, pear, papaya, mango. So like the baby foods, like even the big kids.
That's good. Hey, in mango season in Miami, that's no problem. Get you a mango. Okay, let's talk ear infections, because these are common, happen all the time. Someone's asking, should we go to the ER for an ear infection? At what point should you go to the ER?
Yeah, so I would say no. Honestly, if it's in the middle of the night and your child wakes up with ear pain, you're going to give them medicine anyways. And even if you lug them out and it's a short wait time, and they confirm, you're not going to get antibiotics on board anytime soon. And it takes a solid 48 hours minimum to really see any sort of, positive effect from an antibiotic, if it's necessary. Pain is caused because the eardrum is stretched. And so pus can stretch, even plain old fluid, like when you have a head cold and you feel like you have to pop your ears, that's fluid behind the eardrum. And that can be uncomfortable as well. It's always at nighttime because we're lying down and there's more pressure. But if you suspect an ear infection, you can treat the pain at home. You're probably better off sitting tight and waiting until the morning to call your pediatrician. The ERs are packed with lots of kids with respiratory illnesses. If you feel like you need to go, you should go, obviously. But hanging around in the middle of the night, with all the other things kind of flying around, you're just, that's definitely something that you can probably care for at home, honestly. Yeah. And then be evaluated the next day.
Yeah. Get with your pediatrician. I say, just make it through the night.
That's always the hardest thing, making it through the night.
Yeah. Oh. All right. Talk to us about, I told you my little one had hand, foot, and mouth the same week. My oldest boy had croup. So I was afraid, is this RSV? Is this croup? I
Right.
don't know. So
Mhm.
talk to us about the difference. In RSV is in the news a lot.
Yeah.
So tell us everything we need to know.
Yeah. So RSV stands for respiratory syncytial virus. It is a virus that we know causes a very specific type of respiratory illness in kids. The younger they are, they tend to be more severe. And they cause wheezing episodes. And really, I describe RSV as almost like a viral pneumonia. So it can be a cold in adults and older kids. And that's usually the point of contact for little ones. Is there's an adult who's ill, and it's more sniffles and cough. But if it's RSV in a young one, it can cause significant respiratory distress, wheezing. It's just the lungs are very unhappy and they have a hard time breathing.
Yeah.
And the younger they are, then the more likely they'll have those type of symptoms. The older they are, less likely. But it is in the news because in temperate regions, so like the Atlantic states and up, RSV has a season, and it's generally now it's kind of like a fall winter virus. And for us in South Florida, we see RSV year round, but we certainly will see peaks the same way that that other states who are north of us will see peaks.
Why year round in Florida, if you don't like?
That's a good question. I'm not sure.
I don't know if it was climate
Florida's,
based.
it's probably climate based, but to be honest with you, I'm sure. I mean, all respiratory illnesses, when you think about it, like in those cold climates, everyone is, inside more and kind of hanging out together versus, summertime when we're out and about. And there are summer viral illnesses, but they're a little bit different. But yeah, so RSV can be a problem. So the big thing is good hand washing. And hand hygiene if you have a little one at home. That's probably one of the best, really, that is the best way to prevent infection. There's no vaccine for RSV, for respiratory syncytial virus. So prevention is about hygiene.
That's good. And will you talk a little bit about just the croup cough? You've got lots of experience with croup. I hear your son. I'm sorry.
Yeah.
But that was kind of how my pediatrician determined, we were negative for RSV. And then she was like, did the cough sound like this? And I'm like, yes. So can you, I don't know what we should look for if our kid does start coughing? How do we know if it's just a cold or like,
right. So the true croup cough, which is basically there's inflammation in and around like the voice box and that upper airway. And it sounds like a seal. That's really what it sounds like. Now I hear parents are like, it's croup or it's croupy and it's dry, but a croup cough is a croup cough. We know exactly what it sounds like. It is a seal.
Yeah.
And like many viruses, the clinical presentation, you can decipher what it is based on the clinical presentation. And croup or laryngotracheitis, which is the official name, has that particular sound. It's usually caused by a virus called parainfluenza. And so that's that typical picture. Like hand, foot, mouth is usually caused by Coxsackie virus. So we know that when you see that, that's probably Coxsackie. When you hear that, it's probably, parainfluenza. Any other viral illnesses can do it. And in the last couple of years, influenza can give you that croup clinical picture. And COVID, actually, we also started to see kids when we tested them for this kind of croupy cough in the era of COVID now. They were positive for SARS-CoV-19.
Interesting.
Yeah.
So many things our little ones can.
I know. It's like they're bombarded all the time. So it's no wonder that they're sick often.
Yeah, so true. Okay, let's talk a little bit about vaccines and should children get vaccines and which ones?
Yeah. So I am a big proponent of vaccination and because they have shown to work really, really well against some major illnesses. So obviously we can't vaccinate against everything, but we certainly vaccinate against the things that have caused a significant and serious disease burden in children. Things like Haemophilus influenza B, which often cause meningitis and brain infections, strep pneumo, which causes pneumonias, and pertussis and whooping cough and etc. So the full complement of vaccines are really important. And if they are immune, then it takes those things off the table. So when you have, this persistent cough, could it be pertussis? Well, they were recently vaccinated, and adults tend to be the reservoir for pertussis. That's really, it's really important to have the vaccines. Influenza is another one. Influenza vaccine, often parents will say, no, we don't need that. We don't do flu vaccine. We really don't get that sick. But the truth is, from year to year, when you look at influenza hospitalizations and influenza pediatric deaths, half of them were healthy kids. And so, not all, vaccines are not perfect. They don't always prevent the disease entirely, but they certainly reduce morbidity and mortality. So they reduce death associated to the viral or bacterial illness, which is morbidity, which is mortality, and morbidity is just, hospitalizations or, needing procedures or, extended care or super infections on top of the illness.
Okay. Dr. Torres, this is really great. You're giving us so much. So often I go to the pediatrician, we kind of and I have a great pediatrician. We get our diagnosis, but then I leave going, oh, what did she say? I guess it's
right.
So it's good to be able to just chat this out. And I hope our listeners are enjoying too. I feel like they're sending great questions. So thank you for just giving us a wealth of information. On the note, we received a question about babies and toddlers getting vaccines, and should they be spread out? Because I know sometimes they can give 2 or 3 or 4 at once. What is your take on that?
Yeah, so that's been looked at too, right? So the vaccine schedule and the way that it is set up in a way so that the ones that are at highest risk receive the most benefit from vaccination. And so it does seem like a lot. New additions that probably, I may be dating myself, but that I didn't get, that maybe you didn't get, things like Haemophilus influenza B and the pneumococcal vaccine and hepatitis A and things like that, for example. The idea is to reduce the disease burden in young children, and then also really to have a healthy population moving forward, right? So if we have individuals who are vaccinated, then the disease burden is also reduced, in the adult population. But to get back to the point about spreading them out, it's been looked at, and it honestly doesn't matter. So there was a study that looked at developmental outcomes in children whose vaccines were spaced out versus those were just grouped together based on the CDC schedule. And also just to say that all nations have a vaccine schedule that is very similar to the US. There's some changes here and there, but for the most part, they're vaccinated against the same diseases that we are. And so there wasn't a bit of difference in terms of developmental outcomes. So everybody was the same. So it didn't cause any harm to spread things out. But neither did putting things, keeping them as is, together. And if anything, when you think about it, and this is what I tell parents, I say, what ends up happening though is that we, if we space out the vaccines and you say that you're going to come back and then we get a sniffle and then you don't want to come back because you're afraid to get vaccinated, which I will tell you is totally fine. There are very few contraindications to vaccination, and sniffles and a little bit of cough ain't one of them.
Not a big deal.
So you end up, you can easily be more delayed, in which case then your child spends more time, being not fully protected.
Yeah. Great. Thank you for that. Okay. Talk to us a couple more questions. I'm watching our time here. So we got about 5 more minutes, but let's talk about vomiting. What do we do if our child starts vomiting?
So this is one of those things that sometimes you just got to leave it alone. So if the tummy is very irritable, is very unhappy, it just wants to get rid of everything that's in there. Just let it. And then an important part is bowel rest. So just let the tummy settle down. So, parents worry like, oh my gosh, but they're going to get dehydrated. Well, if you think about it, even a baby will nurse overnight, and then they'll spend 3 hours without eating or drinking anything so they can hold a fast, and then we'll start again. And big kids will go through the whole night, right? 12 hours without eating or drinking anything. So remember that. Okay.
That's good.
So if you get one vomit and it all comes out and they settle down and they poop out, you're going to want to give them fluids, and you should, but sometimes we start the rehydration process too soon. And then sometimes they're hungry, or maybe they're thirsty, and you give them the cup and they'll just chug, because that's what their body's telling. They were like, let's drink something. I'm parched. And then it comes right back up. So generally bowel rest for a couple of hours. And then you can start with small sips of a clear fluid, water, Pedialyte, Gatorade is fine if you have it, but honestly, water is good enough. And then small sips, very frequently add up over time. So that's what you're looking for.
I had made the chug mistake, and I will not make it again.
Yeah. Like, and so so if it continues, that's a different story. If that's a call for the pediatrician. But for initial management, right? Like, oh my God, what do I do? Sometimes it's best just to leave them alone, let them settle down, watch them, look for their color, make sure that they're still kind of nice and pink, that kind of stuff. And if they look pale or not that great, then that's different.
Okay. All right. I've got 2 more questions for you. This one's about choking. I had a friend whose child, or swallowing something, not choking, I'm sorry, but swallowed a penny. But so if we think our child may have swallowed something, what should we do?
All right. So if you're pretty sure that it's a penny, there's no trouble breathing, you're probably okay. Okay. If there's cough, that's a different story, because cough means that it could be in the airway and you don't need anything in the airway. So that is go. So if there was a swallow and there was cough and we're not sure, the default is to go. So chances are, if something was in there, and it's hard to be, honestly, it's hard to be 100% sure. The default is always to go. A foreign body in the airway is never good. And then the other thing that I would mention, which is extremely dangerous, are button batteries. So button batteries, if there's one missing, if they were playing with a toy and you're not sure if they swallowed or where it is, you should go to the ER, and an X-ray tells you where it is, for the most part. And if it is a penny in the tummy, it usually will pass, and they often tell you to go looking for it. Yeah.
My poor friend, her poor child. Okay. Last question comes from our audience about, you were talking about the study about the vaccines, circling back and, spacing them out versus doing them all together. She's asking about any correlation with the risk of autism. Did it decrease the risk of autism, or is there research with vaccines and autism?
So that's its own PG. But the short answer is there's no causation or correlation with vaccines and autism. And that has actually been studied over and over again, not just in the US, but worldwide populations, in terms of, do vaccines cause autism? There's solid research that says no. And certainly, there's always debate about that, and the studies and the quality and like this, that, or the other. But the truth is, and this is what I tell my parents, there's no link between the two. And if there was, then, we wouldn't be doing what we're doing. Yeah.
Thank you for that. Dr. Torres, this is so good. I'm so encouraged, because I feel like I always say that I have the best seat in the house, because I get to ask you directly all of our experts, all these questions. And so it's so helpful. Just personally, as a mom, I think our audience would agree that it's been helpful. So thank you for your time tonight. I want to draw your attention to a couple of things before we go. Join us in 3 weeks